So I want to talk today about a little bit about genetics and mental illness. So I actually have someone here with me that is willing to talk about their history with mental illness, and just we're going to discuss genetics and mental illness and the stigma of if genetics really affect mental illness. So can you just tell me and those that will be watching a little bit about who you are and what you've experienced over the years?
Well, I have been diagnosed with depression, social anxiety, bipolar disorder, and a few others, but
What are some of the problems that you experience with the anxiety and with the bipolar disorder?
I do not like going into large crowds. Groups of people, more than a couple people is uncomfortable for me. Fairs, anything public, I do not like. I'm very uncomfortable in. What else? With the bipolar disorder, I have not very large mood swings, but when my mood does change because of bipolar disorder, it is usually from very happy, very energetic, to very sad and very depressed. And that has not been too difficult to deal with, but it's hasn't helped with everything.
How about, is there any other things that you have problems with?
I also, school is a very hard one. Just very hard to focus on work when it's in class, and group work is very hard, and that's just socializing.
Okay. How do you feel about the fact that mental illness could possibly be genetically linked to people? Do you feel like there's a possibility that this may have been passed on to you, or that you may pass this on to your children in the future?
I don't think this was passed on to me. I don't know if any of my grandparents had any mental illnesses, but I'm not really concerned if I pass it on to anyone else. My children, because if I do, we will deal with it, and we'll deal with it as I have been dealing with it forever.
So if you, how do you think that you would know if you passed it on to your children, or what do you think causes mental illness if you don't think it's genetically linked? What factors do you think are involved with mental illness?
Probably the environment you were raised in at a young age has quite a bit to do with it, probably. If you were just born with if your brain was born with some kind of abnormality from others, that is one of the big factors in it. And just if your environment in general.
Okay. Well, many people are actually skeptical about mental illness and how genetic factors may contribute to mental illness. Almost everyone that I speak to or interview tells me at least one of their mentally ill family members. Often it's a crazy aunt, or they refer to them as a crazy uncle. One of the common factors that I find with mental illness, especially family history, is the presence of undiagnosed mental illness. They may have cousins that have attempted suicide with no history of mental health treatment. They may have sisters or brothers, aunts, uncles, or parents who maybe drink way too much or smoke marijuana or use other substances to self-medicate. They often talk about their dad or their son or their brothers that have anger issues they merely have just dealt with for many years, without really considering the fact that these people may be bipolar or have conduct disorders. Children often come to me amazed that they have acquired their grandfather's or grandmother's gift of seeing spirits. They also may hear voices of loved ones, and this is something that they've heard other people in their family talk about, or they feel like they've been passed on a gift. This stigma often prevents people from seeking mental health treatment regardless of any genetic family presence. So they tend to ignore the symptoms or just ignore the fact that this has been going on for all that time. Schizophrenia has not been genetically linked specifically to one gene, but it has been known, and there's evidence that shows there's genetic factors that predispose people for having or developing the disorder. Bipolar disorder has been linked to families back generations. It's difficult because mental illness has been untreated for many, many years, and people are just finally starting to realize that it's necessary to get treatment for it. So it's hard to really see the research back too far with different diagnoses of bipolar and other mental illnesses other than schizophrenia. People have also been genetically predisposed to utilize substances or have substance abuse history. What do you think about drugs and alcohol? Do you think that could be linked genetically to people? Do you think people could have a genetic predisposition to use drugs or drink alcohol? Do you see it in families, or do you think that's possible?
Well, I think if you're growing up with a parent or another sibling or family member who drinks, does drugs, something like that, you will be more inclined to do it because that's the environment you grew up in.
Mm-hmm.
And maybe with the drinking and the drugs, it might be genetic. You might have a higher possibility, but I don't know.
But you would say environment is mostly a factor, which is also true. A lot of things can have a stronger possibility because of the environment that you're in. If you're not exposed to something, then you wouldn't necessarily want to be involved in that practice, or you may not have an interest in it unless you were exposed to it. So do you think that if your children or you knew a family member that may be more apt to have a genetic predisposition to mental illness, do you think you would encourage them to seek treatment, or what do you think you would do if there was a possibility that someone would have mental illness in your family?
I'd want them to get treatment.
Okay. There is some testing that they can do to help see if you have specific genetic composition that will potentially lead to mental illness, but there's no specific gene or marker that says you have bipolar disorder, you have schizophrenia. There are genes, though, that definitely have been discovered to predispose you to developing the disorder. So I think that it's important that we help people understand to have treatment and seek treatment for mental illness so that we can do more research and discover further genetic links to mental illness. Thank you. Research shows that there is genetic links between mental illness and families, and those that have a third-degree relative with schizophrenia are twice as likely to develop schizophrenia than those in the general population. Individuals with second-degree relative have several-fold higher incidence of schizophrenia than in the general population, and those with first-degree relatives have an incidence of schizophrenia an order of magnitude higher than the general population. So there is genetic evidence that shows that there's a higher incidence in families when the individual has schizophrenia, but there still needs more research to link specific genes to that particular mental illness.